Obamacare could be on life support, and the Supreme Court could be the one to pull the figurative plug. But as we hear the debate and wait for a decision, there is another much larger picture that often seems to be overlooked. It involves doctors, medication, and money. Our guest is a Newsmax contributor, a doctor with almost 30 years of hospital outpatient and inpatient experience, certified by the American Board of Emergency Medicine, Dr. Peter Hibberd. And we're also going to welcome back Newsmax Deputy Health Editor and co-author of the book DaVinci's Baby Boomer Survival Guide, Nick Tate. Gentlemen, I thank you both for being here.
Good to be here.
Let's go ahead and start the conversation here, because with regard to Obamacare, let's leave that on the table for a minute here, but let's talk about doctor shortage. And you have the article sitting right there. 90,000 doctors shortage by 2025. Simple question, why?
Lack of funding, big issue. We have Medicare withdrawing funding from residents training. We have people who are on the reimbursement side of the equation paying less and less. And so when we're dealing with educations of doctors, we need to have more, and we're not being allowed to. That's number one. And the second sign of...
I get a feeling there's more.
The second sign of this shortage isn't just the fact that it's going to be. The truth is that it's existing today.
What kind of doctors are we missing here? Is this all types of doctors, specialists, internists?
Well, there are some specialties that have more needs than others. I mean, primary care has been in a big loss for a long time. Emergency medicine's also in great need. I mean, this is encompassing the entire spectrum of medicine in America, actually in many countries, not just ours. But our particular country is run by insurance, largely. And the people that haven't had insurance have had no say until Obama's system kicked in, and all of a sudden a few more people got insurance. But that didn't solve the financial problem all these people have been having. We still have people who have insurance who don't have the money to pay their deductible.
Now we get down to Obamacare. Here we go, Nick. Now we get to bring that in here, because here again it comes down to the money, the deductible, the people who say they don't have enough money, it confounds many people, because every time you talk to somebody, and I think you even joked about this before we came on the air, who's your insurance company? Most people, half the time they walk in, they don't know, and they don't know what they're allowed to ask for.
Well, the point that Dr. Hibberd's raising is a good one, in that Obamacare does not solve the problem. In many ways contributes more to the problem of doctor shortages. We've got about 10 million more people on the insurance rolls than we had 2 years ago. All those people are seeking care, and there is a declining number of doctors. The other point that I would make is we're an aging population in the U.S. As 10,000 Americans turn 65 every day in this country, over 65 you spend twice as much on health care and require twice as much health care services as under 65, at the same time that some of the changes that are happening, the financial stresses that are being placed on doctors are increasing, pushing them into concierge medicine, pushing them into retirement. The number that I saw, that over the last 20 years, the cost of treating a Medicare patient, just for one example, has gone up about 20% in the last couple decades, but the reimbursement rate from the federal government has only risen by about 4%. And as that gap widens, it's very unattractive for doctors who want to practice. If you are a medical student and you've got, what, $300,000 in medical bills, how are you going to pay them when you're facing those kinds of strains? So it's a confluence of factors, what we might say is a perfect storm for a real healthcare crisis.
What happens then come 2025 when we are 90,000 doctors short?
Well, maybe we're going to have a system like other countries have, where in order to see a doctor, you have to go to the hospital. And perhaps all the doctors that you're going to see outside will not be medical doctors. Perhaps they will be nurse practitioners and PAs, physician assistants. At the moment, that's how we're fixing our shortage.
Is that a solution?
When you go, that's not a solution, it's a patch. Because ultimately, at some point, you need to provide funding. The problem now is when you go, or I go to the emergency room now, you're going to see 2 out of 3 times, you're going to see a non-physician to treat you. It may be overviewed, perhaps they'll never see you during the time you're there, and frankly, the only way to make sure you're seen by a doctor is to insist that you ask to be seen by the doctor. And in that case, you may need to be waiting hours more.
And we still have a lot of people who do go to the emergency room right now because they don't have a prime physician, a primary care provider, so that's where they go. The the emergency rooms get loaded at this
right.
point, and they get overloaded.
That's right. And then we hold patients because the administrations don't allow beds to open upstairs because the funding is basically intended to be penny pinching all the way around. No one's looking at quality only. They're looking at their money first.
All right, I'm going to ask you both to stand by here because the doctors are one issue here, but what about nurses, veteran support staff, and the point? And I'm going to talk to you both about this because this is one of my big banes on this. The point about being gouged from insurance companies and then the drug manufacturers and the tremendous amount of money that they want as well. It still is all about money one way or the other. We'll continue our conversation right here on MidPoint, where we question everything on the Friday edition. Stay with us. All right, back to work. Our guest, Newsmax contributor, doctor with almost 30 years of hospital outpatient, inpatient experience, and he's certified by the American Board of Emergency Medicine, Dr. Peter Hibberd. And also on set with us, Newsmax deputy health editor, co-author of the book DaVinci's Baby Boomer Survival Guide. Nick Tate joins us. Gentlemen, we have now talked a little bit about the doctors, but I'm going to get down to one of my biggest complaints, and that is the quality of care issue. I have had doctors look me right in the eye and say, I can't spend the same amount of time with you since Obamacare. I have to fill out all these forms. I have to ask the same ridiculous questions every single time, and therefore I can't give a quality of care. That, I think, is the biggest problem. People don't feel like they're getting treated by doctors who care.
And if I had someone say that to me, I would say they need to get somebody to help advise them on getting other people to help them. And that's where the role of physician assistants, nurse practitioners, ancillary people, scribes. Now, when I work in an emergency room, I love it when I have a scribe working with me because I go see the patient directly. I look right in their eyes. I'm examining them, talking to them. I've got a scribe doing that stuff for me. And that's the way for the future.
But the patient doesn't want a scribe. The patient wants you sitting there because the patient feels better with the doctor looking at
But the point is the doctor has to find someone to help with the business side of things so you can focus on the patient.
The business side of it is being run by the insurance. They're mandating that, even Medicare too, that the squares get filled in. So if you want it done, you're either going to have a doctor sit there with a tablet and looking at the tablet more time than looking at you, or you'll have a scribe there or someone else helping the documentation go the way it needs.
But how much of that is necessary? Because, again, this comes down to doctors I've spoken with who say that a lot of the stuff that they have to fill out, it's not necessary. They're wasting time. And they say that's been foisted on them by the government and then the insurance companies.
That's been foisted on them by the insurance company, who is insistent that the diagnoses you have there be backed up by an evaluation. And how in-depth did you go? Because your fee is based on the depth of the evaluation and a time factor. And so you have to support it. That's why the EMR has been a tremendous boon for every emergency room, because when you go there, they're all max billed.
Electronic medical records, EMRs you're talking
about. EMR, that's correct.
Let me read something to you. I think you'll find this interesting. There's a study that came out that said that the number of doctors in solo practices have substantially declined from about 40% 30 years ago to about 18% today. Most are being absorbed by hospital networks. They're part of these new ACOs that are part of Obamacare. That is limiting doctors' ability to kind of do their own practices. They're now part of these large collectives. And the comparison that I've heard is that it's like moving from the mom-and-pop store on the corner to the big retail box store that's taken over retail.
Heard that too.
How do you see that changing the profession for you and what you're doing with patients?
You're totally right. And when you sign on with one of these big corporations, very much there's non-competes built into that. And even if you wanted to open up your little thing on the corner nearby, you may be bound by that county, perhaps a larger region. And if they've got multiple offices throughout several counties, you're out. You can't work there. Now that's part of the problem working for big companies, because they do want to lock you in. But the other side of the coin is we're now being forced to do EMRs that really aren't even very good. And EMRs...
As a result of Obamacare?
Not just Obamacare only. I think it's been a trend for years, Medicare pushing primarily that things be electronic. Medicine's not really ready for electronic all the way around, because effectively the electronics have generated much more paper now than we ever had before. And it goes back to your point. When you saw your doctor, he used to be able to put down a brief summary of what you had and get you out the door. Now he's got to put a system inquiry and everything else as if he was a nurse with a supervisor coming looking down his shoulder. The supervisor is the payer. And when you have insurance nowadays, they have the right to look at your record, unless it's a psychiatric record. Your medical record, you're signing it right away on.
There is no answer. It seems like that way to the consumer sometimes. They're always looking, but it seems like we're trying to walk them through a maze that is consistently changing.
Consumers caught in the middle. No
the,
question.
the employer wants more and more, and the consumer wants more and more for less and less, and that's what's happened.
There you go. All right, first of all, Dr. Peter Hibberd, thank you so much for coming in, please.
My pleasure.
I see a guy gets away with wearing scrubs. I want to be able to do that one day, too. That's perfect. A reminder once again that Nick Tate, his co-authored book, DaVinci's Baby Boomers Survival Guide. If you haven't picked up your copy, do it right now. Go to babyboomers711.com. Stick around. We're back to punch out numbers, to punching out politicians. Puns, of course. The political punching bag is next.